Hello and good morning, our dear viewers. You're most welcome to the DAKTARI show, a program which airs on National TV every Thursday from 10 a.m. to 11 a.m. And this is a health educative show which comes to educate you, our viewers, on illnesses which you could have, which you can manage, prevent in the communities, and we bring you professionals who give you the pre-hospital management, the hospital, partly the hospital management, and what you are supposed to do to help these health workers, the doctors, the nurses, the dentists and the dietitians, to help you come up and live a free and healthy lifestyle. Today with us we have Dr. Emmanuel, a doctor at Nova Fina Clinical Center, who is going to take us through what heart attack is. Often we have seen people in the community experiencing heart attack. Some are allergic to age, some are allergic to lifestyle. So he's going to take us through what heart attack is. He's going to take us through the presentations of heart attack, when you're supposed to see a doctor. They'll take us through also the presentations when you're supposed to say doctor, the complications and the preventive measures. You're most welcome to the DAKTARI show, Dr. Emmanuel.
Thank you very much for bringing this tonight. We want to talk about the heart attack that everybody probably is familiar with. Something like that. So many people have seen. All of a sudden it is acute. So we'll just briefly look at an overview and then we see how it presents. I guess everybody knows, and then when you can see us, the complications that may arise. So the heart muscle receives blood. It's supplied by blood through some arteries that give it oxygen in order for it to pump and be able to give the rest of the body organs blood satisfactorily. So just as the heart pumps blood to all the other organs, it must receive blood to help it pump. But if those vessels that are supplying the heart with some blood have a problem, and the heart muscle is not getting enough blood to supply it, then you can actually feel discomfort. It causes some form of discomfort and sometimes pain. And then you see people presenting with symptoms of the heart attack. So usually the problems are related to a decreased supply of blood and therefore oxygen to the heart. And that is basically heart attack. That sudden onset phenomenon that someone feels when there is inadequate supply of blood to meet the heart muscles' demands for pumping is what we call a heart attack. Normally, the main common causes are plaques, fat, the abnormal fat deposits in the blood vessels there that eventually keep on narrowing the lumen of your coronary arteries, the arteries that supply the heart. And then as a result, if there is significant narrowing of the lumen of the blood vessels, sometimes it can be closed even completely. Those plaques from the sides can slough off and then lodge, and blood can't go distally. And as a result, the heart doesn't receive enough blood, and then all of a sudden, people can actually collapse.
So it's all about failure of the heart muscles to receive blood, enough blood.
Insufficient blood. And what is important in the blood is often the oxygen, because the heart must pump to receive adequate, to supply adequate amount. That very same blood, a fraction of it comes back to it.
Okay. All right. Now, some the viewers may be asking, how can someone with heart attack present?
Exactly. Very true. The most common presentation of a heart attack is actually pain, because you are not receiving blood. There is pain, but this pain can be on the left side of the chest, in the center of the chest, but how you feel it like maybe some pressure, some tightness, some squeezing in the chest, that eventually sometimes it moves. It can radiate to the neck, it can involve your teeth, it can go to the center of the back, but you are just feeling this discomfort, or rather pain. And that is the most common presentation of a heart attack. you actually get attacked. The other one is you can have some cold sweat. You feel cold and then you get fatigued, because once the heart is attacked, it is not pumping enough blood to the rest of your body, you feel fatigued. So that fatigue around that moment can actually be a cause. The other one is difficulty in breathing. People keep saying dyspnea, dyspnea, but you can actually fail to breathe. After all, blood that moves through into the lungs also moves through the heart, and now the heart has got an attack. Your lung, you can feel difficulty in breathing to move that blood. And those are signs you can present. You can present with pain, you can present with difficulty in breathing. Yeah. Those are the most common ones. But some people, actually, the first presentation, they collapse because the blood supplies the brain, and so they can collapse. So if somebody collapses close to you, you can actually begin thinking the most common causes of sudden collapses are related to the heart, and the diseases of the coronary arteries, blood supply, that eventually cause the heart attack are the most common of all the many diseases of the heart attack.
All right.
Yes, but in some women, the pregnant women, the presentations are quite atypical. Somebody can just have a sharp pain, probably behind. They have some different physiology. They just get a sharp pain in the back or some discomfort. They could actually be having a heart attack. Now, heart attacks are often sudden. Sometimes they give you warning signs in the beginning. Pain that comes and goes. You even feel it. You're a footballer, you have not played for 1 month, you enter the football pitch and try a bit, and then there's that pain that keeps going, you try, and then now those are the warning signs you could be having a heart attack. So in many people, they get these warning signs. Some fatigue keeps coming, it keeps going, you could be having a heart attack. Please, you would want to take precautions of the symptoms. So those are the most common presentations that you can have for a heart attack.
All right, thank you very much, Doctor. So now, I know you have had the experiences of people who have heart attack. Do they always present with all these complaints you have told us?
Not all. They can present with a few, maybe one, not all of them. Somebody can just have pain, shortness of breath. It's common there's a footballer, was a great colleague of mine who had entered the pitch. Good player, he plays number 8, a very strenuous midfielder, but he had not played football for about a year. So he entered the pitch and then started to run. It was a football match, an interplay between the teams. And so his colleagues noticed that actually he was leaning on his chest. When he was asked, he said the pain is so bad, he's seeing darkness. And each time he tries to bend, the darkness disappears, it becomes a little bit bright, and then he has the darkness. That was a heart attack.
So meaning also it can come with visual impairment?
Yes. Okay. It's not really visual impairment as per se, but when you see darkness, it's just the brain's response. You're actually fainting because the brain is trying to shut down in response to inadequate supply because of a heart attack. Okay, so there are so many. There is a certain lady who was moving in the market to buy some things about 3 weeks ago, and she suddenly collapsed. When we found her and we brought her to the hospital, we discovered the rhythm of the heart was not beating well. She had an arrhythmia. So sometimes the heart attack can actually present with its complications, the arrhythmias. So if you have occlusion and it is not brought up in time, the management is not quick enough, it can actually cause complications. And one of the complications you can have of heart attack is that you can have death of the cardiac tissue. The cardiac tissue actually dies, and the heart part of it is not working well. And as a result, the electricity of the heart does not move very well, the electrical signaling. And as a result, you can actually have a rhythm that is irregular. We call an arrhythmia. So you can actually present with an arrhythmia. The other one you can present with is something we commonly call shock. In this case, it is as a result of the failure of the heart. We tend to call it cardiogenic shock. And shock means that the vital organs, the brain, the lungs, the kidney, the liver, and of course the heart are not receiving enough blood supply. And so once the heart gets an attack and it's not doing that for just a short minutes of sustenance, it's not supplying, you go into shock. It's very life-threatening to peak. In other words, people could actually die. And some people, sudden death has been the presentation of a heart attack, usually in the worst-case scenarios. It just happens.
The way you have presented how serious this heart attack is, it's indeed worrying, and our viewers have to take note of what a heart attack is. So maybe, Dr. Twas, which symptoms or which flags can someone or a viewer based on that I need to go and see, to visit the hospital? Maybe I could be at risk of having a heart attack.
Okay.
Yes.
Probably the risk factors. But we will look briefly in a few moments to come about, we'll talk about the causes and the risk factors. However, some people have been having these warning signs, they've been having recurrent attacks, they've actually gone to doctors. Doctors have given them some medications, they have chronic illnesses, they are on medications, and some of them include nitroglycerin, a nitrate that helps dilate those blood vessels. Some of them are on aspirin related to the heart. They've actually gone to hospital, and they have a higher risk. So if you really have the risks, as we shall see how to know you have the risks, the first thing, if you think you are having a heart attack, you've got any of those symptoms we've mentioned, from pain to shortness of breath, tightness, chest heaviness, or sudden collapse. You've seen your colleague has suddenly collapsed.
Yeah.
Number one is you call for help. So many people in the developed countries have that figure, 991, or emergency help. We have clinics running quite along anywhere. The closest you can get, a colleague who works in any of them, you can get Red Cross numbers. There are the shuttles moving around that help. Simply call them, and that is the first step. If you think you are having a heart attack, call for help, because that help is going to be very necessary for you as an individual if you have the heart attack. And then find a comfortable position away from anything dangerous. And when we talk about a comfortable position, we like you to sit on the ground when you are leaning towards the wall with the legs slightly flexed, just comfortable. The chest is upright, okay, to enable yourself recover. And if you can't sit, it is good you lie on the left side of your body. Just flex a bit of your legs. Some of you know the recovery position. Press your colleague or find him seated in a comfortable. He should be comfortable enough to allow his body recover. You are helping him as fast as you can, as help is coming. And then if they have any medicines, some of them have nitroglycerin. If you are trained and you know how to give them, pick their pills. Some of them move with it in their bags. Give it to them as you prepare for help or to go to the nearest facility. That first aid is actually life-saving for you. The calling for help, the putting in recovery position, and taking your medications. The aspirin, the nitroglycerin, you give them to the patient. And then you continue monitoring the patient as help comes. That is what you can actually do when you think you have a heart attack or when your colleague has a heart attack. Now, if he had a heart attack that made him unconscious, it is very important, after calling for help again, we start with it from people you may know. The other one is try to listen and see if he is breathing, if his chest is moving, and if you can, check if his heart is beating. If none of those is happening, you need to start what we call cardiopulmonary resuscitation, removing him out of that life-threatening danger. It is as simple as putting your hands on the chest of an adult and pressing very fast. You can do this, 2 of them in a second, 2 or 3 of them in a second. You press them very fast, okay? As you keep mobilizing for help, begin it. That is called a chest compression.
Does it have numbers, like a certain count I'm supposed to push?
Absolutely, it has. And it would be nice if some people in the community, the team, know it, the health teams that we've gone, the village health teams, actually know these emergencies. Why we emphasize you call for help. Because some people have not gone so much deep into studying them. But there are a number of times they know them. Normally, if you are trained, you know that for an adult, you start with 30 compressions, 30 chest compressions that are quite quick, 2 of them or 3 within a second, but 30 rescue compressions. And then after that, you give rescue breaths, what people can call mouth to mouth, or using instruments if the help has already come. But that is enough to help lift the heart that had got an attack and stimulate it to start pumping again to supply the blood. So again, we'll just recap, call for help. People out there, call for help. Their colleagues, so many of our colleagues have actually experienced this, and it's not the first time they could be meeting such a scenario. So if you feel you have it, call a colleague. Secondly, find a comfortable position. If it's your colleague, put him in a comfortable position, either the recovery or sitting in a comfortable position. Thirdly, if they have their medications, nitroglycerin, aspirin are the common ones, get a pill and give them as they've been taking, directed by their physician. They are often forewarned in many cases. But if you are not forewarned, there is no problem. Help always comes when you call for it. They say those who seek help, help comes. And then you keep monitoring. If he was unconscious, you've called for help, he's not responding, help is coming, but you have your energy, please get a colleague's chest, put your hands, and give us that energy of very fast compressions. Enough, deep enough, deep enough. Don't break the ribs, but just give pressure. That is enough. That will help at least wake them. Then you give them the rescue breath if you've done it for about 30 seconds. You can do the mouth-to-mouth breathing. It's not difficult. For the sake of helping people, saving lives, please, you can do that. But very importantly, that is what we do when we encounter somebody with a heart attack. Heart attacks can actually kill, and those are the symptoms. Your pain, tightness, we keep repeating, your difficulty in breathing, fatigue, the lightheadedness, dizziness, what we call vertigo. The head is turning, the place is becoming dark. Any of them, they don't have to be so many. Just only one can tell you it's a heart attack. And it's so many people present, some people actually don't have symptoms, any of those ones. They don't. Some of them have mild symptoms, the lightheadedness, the dizziness, and some of them have severe symptoms, the loss of consciousness with a heart attack. But in either case, you can get a heart attack. At first, call for help. Find a comfortable position. Give them the pill if it's there. Resuscitate them with the CPR if you can. Basically, that is what we do.
Okay. So now maybe to ask you, doctor, regarding this presentation I've given to this pre-hospital management you have given to our viewers, and which they have noted down. Some could like you are in a community, someone gets a heart attack, we do that management, we do the CPR, the 30 compressions, but the person recovers. Is it still advisable to take this person to the hospital? Because some people may just get reluctant since the person is now back to life and is normal, so there may be no need of visiting the hospital.
Okay, that's quite interesting. Visiting the hospital is always important when you've had a heart attack. Preferably, if you feel you are going to, if it was possible that you can know that tomorrow at 5 p.m. you would be having a heart attack, we would want you to be in the hospital at 5 p.m. You get the heart attack and then we manage you. So really going to the hospital is your goal, that once you've got a heart attack, not necessarily the hospital, but for medical care, medical care, the team, clinics around, the health facilities that can do that, they can manage them. Is your goal, but you just got an attack. So it should be like you're on the way to the hospital. So after you've recovered, come and then report to the doctors. They can actually probe further, advise you better before you have another one. And that would save you tons of your minutes in this natural life we have with a heart attack.
Okay. So also regarding still that, you gave us the presentation, so the pain, the difficulty in breathing. A viewer may be asking himself, can still those presentations be like the warning signs, or there could be specific warning signs to know, maybe in the next 10 minutes I'm going to get a heart attack? Yes. So are they still these presenting complaints? Could they still be the same as the warning signs someone can present that I may have a heart attack soon? Okay.
Yes, that's quite it. As we said, some people don't manifest any of those symptoms we've mentioned.
So it can just be
categories. Those 5 categories, from pain in the chest that can radiate, can go to the back, from difficulty in breathing, from the lightheadedness of the brain, the vertigo, the dizziness, the head turning, from the nausea, unspecific symptoms of the gut, the nausea that you can be having. You can actually have none of them.
Okay.
You can have mild symptoms, just the gut, the nausea. And if you've ever had a heart attack, those you should consider as your warning signs, unless proven otherwise. You should consider you have a slight dizziness and you have a prior history of a heart attack, or you just don't feel well with the lightheadedness. Those could be the warning signs, because they actually come, warning signs come and go. So you feel this lightheadedness, it comes and goes. Please use those ones as your warning signs, dear people.
So they can be specific to a given individual?
Yes, they vary from individual. As we've seen, some people come actually when they are unconscious without a warning. But a good number of people have these signs. And I know out there, some of you have felt them. You've been in your restaurant or you've been in your shop sitting 8 hours a day for the rest of last year. But you feel it when you try to walk out of the restaurant very fast, you feel that catching pain, but nevertheless it disappears. You walk home and sleep over. Please, those could be the warning signs that you could be having one of them. You went to the latrine or the toilet, finally you were doing good stuff there, and then you got up, and then the head felt a little bit not well, lightheaded, dizzy a bit, and then you came out. My dear, that could be a warning sign. It can happen anywhere. You can be warned anywhere. You could be swimming, then you only survived and came out with the heart beating. My dear, go to the hospital. It is not luck. It could be a heart attack. So those are the signs you could be having that can warn you. The other one that can warn you if you don't have symptoms is your lifestyle. Okay? If you have a lifestyle that is quite risky, as you learn in the next.
Okay. All right. Thank you very much, Doctor. So maybe someone got the heart attack, and these people did that pre-hospital management, and they have brought the person to the hospital. Which management do you always give to these people? And also maybe which requirements do you always require from the caregivers in order to help you manage the patient recover to the fullest?
Okay, that's quite good. So when you come to the hospital after getting an attack, you've done the first aid, and then you finally come to the hospital and we've seen you. Normally what we do is to ensure you are out of the life-threatening state of heart attack. And those are the basics we keep doing. We check your airways, we be sure you are breathing, your blood pressures are okay. And soon than later, we begin to investigate and we examine your heart if that is the most likely cause of the problem. We panel beat and we look for any causes and risk factors that you've ever had, and then make the diagnosis. We do investigations. We can place a few wirings to check on the electricity in your heart. We call it an electrocardiogram. People often say the EKG. We look at how the heart is functioning. We can do an echocardiogram to look at the structure of the heart. In case we suspect other complications like heart failure, we want to do a radiogram, but we want to investigate for causes, other causes in your blood. So we do a good number of them. But the end point is usually to tunnel towards the cause of your heart failure. And we manage it often in 3 phases broadly. One is definitive, that we should get the cause of your heart failure and treat it. And in very nice settings, which of course we have, if we found that there is an occlusion by a plaque into that blood vessel, we can go invasive. And then we can break it, we can remove it and restore blood supply. We can do a good number of procedures to restore blood supply to the heart. We also give medicines to help the heart in its contractility that we've mentioned. Once we are here, we can give those medicines and eventually help. The other broad category of treatment is symptomatic treatment. We ensure you don't have the pain, the lightheadedness, which often disappear with restoration of the blood supply. And thirdly, which to us seems to be the most important, is the health education of both the patients and his caretakers. That once they've understood this condition, they can actually be able to notice the signs early enough and report early enough for the management. But you out there, what you need to know is once we've managed you, you will come, we'll get the cause of your heart, we'll manage your symptoms, and most importantly, educate you on the management of your conditions. For the details of the management, you can always come and ask to those levels. I know we can't finish all those details within just a speck of a minute, but basically that is what we do. And it's possible that people can live a good quality life after a heart attack.
All right. Thank you very much, Dr. Emmanuel. Indeed, it has been an exciting first segment. Hope also the viewers have gotten to know what heart attack is, the presentations, when can you see a doctor, and also he has taken us through the pre-hospital management or the first aid and what they always do in the hospital to manage our patients. So maybe, Doctor, since in the next segment we are coming with someone new, you can give in your conclusion remarks as we are breaking off for the first segment break.
Oh,
yes.
Okay, thank you very much, dear viewers. Thank you also for giving me the opportunity to tell you about a heart attack. But as we've said, if you have any of those symptoms of a heart attack, please get yourself help and always come to the health facility. It is life-saving. We need you to have a better quality of life. Otherwise, the quality of life, if not managed with a heart attack, is very poor. There's really not much, but it's that simple.
Okay. Thank you very much, Doctor, for giving in your time. And also our viewers who have been with us. So let's first get into this short commercial break, and we shall be back in the next segment where we shall take you through the risk factors. Which things could you be doing which could expose you to get a heart attack? Thank you very much. Let's get back.
West Nile TV, lighting up the region.
brand new Global Star TV with StarTimes Inside Technology. New TV innovation with an inbuilt decoder that connects you to both StarTimes antenna and satellite signal. With StarTimes Inside Global Star TV, you can enjoy over 300 local and international channels, 1 month StarTimes highest bouquet for free, automatic system update, more benefits, more affordable. StarTimes Inside Global Star TV is available in all StarTimes branches and dealers countrywide. StarTimes Inside, entertainment inbuilt.
West Nile TV, lighting up the region.
We'll be back, our dear viewers, from that short commercial break. It's still the Daktari Show, a health educative show which airs here on West Nile TV every Thursday from 10 a.m. to 11 a.m. where we always bring you doctors, we bring you nurses, we bring you dentists who come and educate you matters regarding health. And today's session we are tackling heart attack. And in the first segment we handled what heart attack is. We looked on the presentations, how can someone present if you have a heart attack, and also the first aid you can give to patients or our friends who could get a heart attack when we're in the community with them. Then here in the next segment, we are going to tackle what are the risk factors, what are the causes of a heart attack. We shall look on the complications in case you poorly fail to manage yourself. And then also we shall look on the preventive measures. How can you prevent yourself from getting a heart attack? We'll be back from that short commercial break, and in this segment, we have Dr. Feta who's going to take us through the causes, the risk factors, and also take us through the complications and preventive measures. So let's pick on from the discussion. Maybe you can also first introduce yourself before we proceed.
Yes, I am emergency nurse, Feta Humphrey, not Dr. Real. Dear viewers, you're most welcome for the next session where we're going to tackle risk factors related to heart attack.
Yeah.
Thank you.
All right. Thank you very much, Mr. Feta. So let's pick on which things or risk factors could a viewer do to predispose him or the family to get a heart attack?
When we talk about the risk factors, these are things that might bring you, or these are things that are predisposing, that brings you closer to what is going to affect you. Most likely, when we're not talking about risk factors that are related to heart attack, these are things that may likely bring somebody into heart attack. One of them is lifestyle. When we talk about lifestyle has very many things that are piled into. One of them is tobacco use. When we take cigarettes, people think it is a modification of life. Some people take because of curiosity, some people take because of peer influence, but it has a very heavy impact on the heart. It has a very heavy impact on the blood movement into the body systems. As a result, when we take it like that, the continued use of it affects affects the blood flow into the heart. I remember when the first section was going, the doctor explained how the blood moves into the various system of the heart and into the whole body, and how it also how oxygen moves into the body. So, however, when we use tobacco has what we call nicotine and tar, which are very, very, very harmful substances to the body. As a result, it leads to heart attack.
Okay. So it's all about those contents in the tobacco, the nicotine and tar.
Exactly.
Okay.
We have unhealthy diets that may predispose somebody to heart attack. What do we mean by healthy diets? Some of us eat uncontrollably. There are foods which are very fatty. We understood when the doctor was explaining about when he was explaining about the heart attack, he did mention that when the heart valves are blocked, it makes what blood movement into the heart vessels very difficult. So when we eat a lot of fats, or when we eat a lot of food that brings that a lot of fatness in the body, we see that the lumen of the blood vessels begin what narrowing due to the fattening. What happens is the fatty deposits that occlude the blood vessels block the heart. As a result, heart attack.
Okay.
Yes.
So maybe a viewer may ask him or herself, which fatty foods can I eat to predispose me to get these fats to block the blood vessels? The specific type of foods, if you can sample out any.
The specific type of food, mostly I will say fatty foods, we avoid them. Meats that have a lot of cholesterol, we need to avoid them. Mostly I advise my people to use a lot of greens in their diet. I advise my people to have a lot of fruits in their diet. I advise my colleagues to have a lot of fluids, drinks, water in their diets. Eliminate or reduce a lot of salt intake. We should take minimum salt, we should reduce in sugar intake. As a result, we are fighting about promoting the health of the heart.
Yeah.
Yes.
Okay.
Yes.
So the next factors.
The other factors are, we have resultant diseases that causes what? That predispose somebody to what? Heart attack. One of them is high blood pressure. When you have high blood pressure disease with you, you are prone to what? You're prone to heart attack. Reason being, high blood pressure, this is when the blood actually uses a force to move into the lumens of the what? Of the vessels. So when blood uses that, we have systemic, we have diastolic kind of pressure in our body. So the systemic, that's when the blood saturation goes into the systems, comes back to the heart, and then diastolic, when the blood moves to the rest of the body parts and comes back. So you find that when you have such kind of disease, hypertension, it predisposes you to what? A heart attack.
Heart attack.
Yes. We have history of eclampsia or preeclampsia. This is the pressure during pregnancy.
Oh.
Ladies have this. You see, first of all, their stomach is compressed because of the development of the what? Of the baby. It pushes the heart to around some distance. That's what we have the diaphragm down here. If you check, the diaphragm is here, the uterus is here. So as the fetus develops, the stomach keeps what? Increasing in size. As that happens, the heart activity is actually increased. As the heart activity is increased, cases of hypertension comes. When it comes, you see the pregnant. Okay, let's just bring it in layman's term. The pregnant stomach compresses the what? The chest. As the chest is compressed, the pressure increases. As the pressure increases in the what? In the heart, because the faster rhythm of the heart does what? I'm forgetting the common term, but okay. Nevertheless, as it compresses the chest, what happens is the blood flow, if it increases, what happens is they will begin having some pricklings around here. Around here, or somebody says I have prick around my chest, which we call myocardial what? Infarction. And when that happens, what happens is it predisposes them to what? A heart attack. So
it comes also almost like the high blood pressure.
Yes, that's the high blood pressure in what? Pregnancy.
Oh.
Leaving alone the other what? Hypertension in what? In non-pregnant people, yes. In non-pregnant people. So as a result, it predisposes somebody to what? Heart attack. Obesity is also another one. Obesity is like some people are extremely fat. When you're very fat, the cholesterol in your body is also what? Increasing in size. As such, it leads to blockage of the heart valves still. When the valves are blocked, what happens is you are prone to what? Heart attack. So as a result, we normally say people who know they're a bit bodied, actually not only them, the entire public, we advise them to do what? Enough exercise. We advise them to do enough exercise, because when you don't do exercise and you leave the body in active format, you have accumulation of what we call lactic acid into your body, and the fats accumulate into the body. So this happens by mistake. It accumulates in the heart valves or into the heart vessels. What happens is definitely you suffer from heart attack. As we stated, it is not something that is going to come like today. You realize signs and symptoms. Some people show signs. Some people it comes that suddenly. You will not know that you're having a lot of accumulation of what? Fats into our cholesterol, into the heart valves, until one day maybe you'll be reading your books, or maybe you'll be just chatting with friends or doing other activities, you just rise up to heart attack. That's what happens. So we advise them to what? To have a lot of exercise in their routine activities. And then next we have diseases like diabetes. Diabetes also predispose somebody to what? To heart attack. Because we say people should reduce intake of sugar. People should reduce intake of too much intake of what? Salts. Because these are the what? Predisposing factors that can lead in somebody into diabetes, that can lead somebody into hypertension. So as you reduce sugar intake, and most times we think sugar that we say we should reduce is the crystals that people eat. It is not that. We have variation of sugar that somebody has to reduce. One, the starchy food we eat, things like potatoes, things like posho, those things they are rich in sugar. So the sugar intake in them, if we reduce the content, I would advise people to have, how do we reduce them? One, by eating balanced diet. You see that? That's the scenario where you can reduce sugar intake, because we're living in a place where most of our food actually is starch and proteins. The proteins mostly we get from the beans we eat. We get them from the nuts paste. We get them from meat, like that. And remember, we said meat has a lot of what? Cholesterols, most especially. So the advice could be, someone eats, maybe you get your meat, you first dry it a bit, then you eat. We call it smoking maybe. Then we say, in your diet you add things like millets. Millets have little cholesterol. Things like pumpkin, things like yams, things like, those ones, they help a lot in reducing what? The quantity of diabetes. So as you also come to the sugar reduction, we expect somebody to have a lot of greens in their diet, a lot of plain mineral water you take, reduce sugar intake, these crystals, you reduce them. Yes, there it will what? The predisposing factors have what? Has to come to minimum. Then we have another risk factor called the age. As someone ages,
because
the
actually I've seen it's mostly common in these people, those who are adults.
Exactly.
Aging.
Why does it happen? So because as you age, the cells begin to die. As the young ones come, your cells can be regenerated. One dies, another one comes. One dies, another one comes. One dies, another one comes. Until you reach a certain age, from 55 and above for males, from 45 and above for females. As you reach those ages, we don't expect unnecessary growth in your body now, because you have reached actually the maximum. We call it the diminishing return. You have reached that. If you're somebody who did business, you've reached a diminishing return. So as it reaches there, what happens is you are prone to what? Heart attack. When any disease that attacks you, because the heart supply blood to the whole body parts. So when any slight problem you have with the heart, it leads to another problem. Maybe the kidney brings it to the liver, you see it continues to be now the related things. So we say as we age, we need to also impact on what? Lifestyle. We have what we call family history. If you had heart attack or heart disease in the family lineage, time will come, if we don't take precautions, time will come, it will also be transferred to generation.
Meaning like it can be inherited.
Exactly, it can be inherited. If maybe I have it, maybe the children I have, the offsprings I have, if they don't take precautions within themselves, like doing exercise, like not living sedentary life, they'll be healthy. But if they continue having sedentary life, watching TVs every time in the house, not moving outside to do exercise, playing a lot of indoor activities, it disposes them to what? Hypertension, because we already have it in the what? Family lineage. So we have autoimmune conditions. That is now when we come to immunity. Some of us have active immunity, which are maybe because we do a lot of exercise, maybe because we follow a lot of health education, maybe what doctors tell us, we follow them. Then maybe because we are born in naturally a healthy land, we have fruits, mangoes, which are free of charge. We have greens, you just go to garden, you pick them and you come and eat them. It boosts our immunity. But now you're going to take a scenario whereby you go to other places where those things are scarce. You don't get them. So somebody having autoimmunity is actually a rare thing because of what? The diet or the feeding habit or the lifestyle in that kind of environment. So it predisposes us to what? Still heart attack. So what do? We need to have exercise. We need to have all those other things my colleague mentioned. If we have them into practice, you're going to realize that heart attack becomes what? Something easier. Yes. Then tobacco, I thought about them. Unhealthy diets, I talked about them. Yes, I think literally that is that.
Okay.
Yes.
So thank you very much, Mr. Feta. You have taken us through these risk factors. You are like the age. You have taken us through the family histories. You have taken us through the feeding, like the eating food which is full of fats. Hope our dear viewers are getting to note of these factors which you can do daily and they expose you to get a heart attack. So maybe a viewer may be asking himself, you have, in today's presentation was about heart attack. We have seen what it is. The presentations. Maybe we had someone who had a heart attack and you have done the first aid. You have taken us through the risk factors. If you may ask, if he or she has a heart attack and is reluctant on managing this heart attack, which other complications can this person develop?
That's very interesting.
Yes.
Heart attack is something real. I really never wanted to see, like when somebody has it, or maybe somebody presents with chest pain. The public, our society, should not take it for granted. Aroa Western Nile has been known for activeness. One, they have to call ambulance immediately. We have emergency line 6262 or 6161, or you call Red Cross. Emergency will reach at your rescue. That is the one. However, we have complications that somebody may present with if he is not taken concern of. Which complications include? We have what we call cardiac arrhythmias. This is an irregular heartbeat that comes and with a lot of palpitations. You see the heart beats at a faster speed. That means there's something that is taking place with this person wrongly. And then you will see this person maybe sweating profusely and with the cold skin. Definitely, we need to take precaution. Take this person into the as a community setting. We put this person on recovery positions. Doctor said, "Oh, you put this person like in a proper positioning where you see the chest movements can come well. If we can do the chest compress, let us do them. Mouth-to-mouth breathing, if you can do them, let us do them immediately. Then we have what we call cardiogenic shock. Somebody presents into a shock. Shock comes with also still sweating, with the cold, clumsy skin. You put, if the person sweats profusely, you think the person has been bathing, it does not been bathing. Definitely, let us remove the clothing. After removing the clothing, we seek for immediate medical care, urgently. If it finds at home, don't look at where Feta is, don't look at where Dr. Madel is, rush to the next medical center, rush to the next clinic. From there, they will direct you to the main help afterwards. Otherwise, it will be history, which actually we never wanted it to happen. And then the other thing is what we call heart failure. The heart will fail. When the heart fails, heart is the generator of the whole body. When the heart fails, you expect the brain to fail. When the heart fails, you expect the livers to fail. When the heart fails, you expect other organs to fail. But before we reach that complication, we say what? First things first. Yeah. I normally call myself 1, 2, 3. 1, 2, 3 means do one thing. Second one, where you can reach, where your hand can reach, not reach, hand over to the next person. When you hand over there, that one also hand over to the there. We might not reach that heart failure. Yeah. And then we have what we call pericarditis. This is an inflammation of the sac tissues of surrounding the heart. The sacs, the heart linings, the tissues that are lining the heart. So when they also die, we call it complication of the heart attack. And then we have cardiac arrest. Just from nowhere, the heart stops suddenly. When it stops, the next can lead us to death. Somebody can actually die as a result of that.
All right. Yes. Thank you very much, Mr. Feta. Hope our viewers are getting to note of the complications you could develop if you poorly manage yourself or a relative who has a heart attack. So maybe the viewers today we have been on heart attack. They may be asking themselves, how can I prevent maybe my family or my life from getting this heart attack?
That's very interesting. Yeah. It's very interesting and very important that viewers have to know how to prevent them getting heart attack. Yeah. One thing is lifestyle. Lifestyle comes up with very many things. People think lifestyle is when somebody dresses up, goes to the roadside, lives a smart life, maybe. No, lifestyle cuts across very many things. Lifestyle, one, is going to be in diet. Are you having healthy diets? Because when I was talking somewhere, I mentioned good feedings that we're supposed to take. Avoid foods that are fatty, avoid food that are having a lot of cholesterol, avoid overuse of sugar. So when we eat greens, when we eat food that are rich in vitamins, proteins, but not very fatty, that's another good lifestyle. Another lifestyle is when we do routine exercise. In the morning, maybe you do push-ups, you run around, maybe sometimes go and swim. There, you're actually giving enough activity for your heart. The heart will pump blood freely. It will have no frictions. As a result, you're healthy and you've prevented actual heart failure. It's not something very difficult. Let us do regular medical checkups. We come to medical facilities and say, doctor, I want to see how my heart rhythm is. ECG is not something very expensive. They check for you, then they give you a readings. Yes, like that. And then maybe if they find out there are other related things that are trying to affect your heart, doctor will give you, you see here the heart is like this, see, why can't you do this? When doctor tells you that, definitely you have prevented something that was going to actually take your life. Another one is, we have people who are having diseases like hypertension, diabetes, among others. When you have those diseases, definitely your doctor might have told you the following medications, take them like this. Please, let us not take it for granted. Let us take the medicine as prescribed. Let us not do self-medication. Maybe you have pain here, you rush and pick your Panadol without, no. But the medicine doctor has prescribed for you, maybe the insulins, the metformins, the hypertensive drugs, there are very many. I can't give their classes because we have beta blockers, angiotensin converting inhibitors, and all of them, when they prescribe them for you, please take them as recommended. When you do that, life becomes easier.
All right.
Yes.
Thank you very much, Mr. Feta. Actually, what I've noted from the preventive measures, I see heart attack can be prevented. Hope all our viewers also get to know it. Mainly it's what I've gotten from my case. It's lifestyle. The diet you're having and also the daily exercises you do. If you do some regular exercises and you manage your diet, you'll be safe and prevent yourself from getting a heart attack. So maybe Mr. Feta Emmanuel, you can give in your conclusion remarks as we are ending the show.
As a concern, I want the community to pick it up. Let everybody learn chest compress. When we learn the chest compress, it will help us a lot, because there are very many causes of heart attack. I met a friend whose brother got electric shock. When he got electric shock, the heart was failing to function. So what community did was people began picking cold water, they were pouring on the patient. Others were picking sugar, smearing the body because they considered it like it was a burn. So I say that was actual time wasted and they did a lot of nothing. What they could do is placing this man in a quiet place, placing him rightly where the chest could receive actually enough oxygen. And then if they could start the chest compress. By the time the ambulance would arrive, because they called us actually, we rushed to pick the patient. By the time the ambulance arrives, the heart could gain back its functioning. When the heart gains back its functioning, where we reach the next emergency care, the person will definitely survive. So the community has to get that. Yes. Thank you very much. My name is still Feta Hamfred. I am an emergency nurse from Navafina Medical Center.
Okay.
Yes.
Thank you very much, Mr. Feta, and also Dr. Emmanuel, who came to educate the viewers of Snack TV on heart attack. Indeed, it has been an exciting episode, and also our viewers, I know they have learned a lot, and they will also do what it takes to prevent the occurrence of heart attacks in their communities and their families. And also we are grateful to Novafina Clinic for giving in their personnel to come and educate the viewers of Snack TV. Thank you very much, and also to the viewers who are with us from the start to the end of the show. Till we meet again next Thursday from 10 a.m. to 11 a.m. for the DAKTARI show. And I've been your host, Sunday Junior Tom. Thank you very much. Bye-bye.